Now this is about the clinical manifestations of leptospirosis. So when should I suspect? Again, as already said, like any other tropical fever, all this lepto, enteric, dengue, all this present with an acute and differentiated fever. Okay, they don't have any specific localizing sign. So these are fever without any localizing sign. Unlike meningitis or respiratory infection where it localizes to one particular system like urinary infection. Here they don't localize to any particular system, they have a multi-system involvement or they are without any localizing signs. Okay, so any acute febrile illness, the patient presenting with fever, headache, severe myalgia, prostration along with a history of exposure to the infected animal or the contaminated environment like say after a heavy rainfall or flood or say after swimming or something like that, then you should always have a high index of suspicion for leptospirosis. Okay, along with this history, if the patient is going to present with calf muscle tenderness, conjunctival suffusion, which is very classical of lepto, or the patient is going to have anuria, oliguria or proteinuria, jaundice, hemorrhagic manifestations, meningeal irritation or abdominal symptoms, you should always suspect leptospirosis. Okay. So once suspected, what are the investigations that we are going to do? Of course, you are going to run a complete blood count. The WBC count can be normal or there can be leukocytosis, okay, with a neutrophilia can also be seen. ESR can be elevated. In liver function test, already we discussed there is mild elevation of transaminases, AST, ALT with mild elevation with bilirubin elevation out of proportionate to the icterus, okay. So hyperbilirubinemia out of proportionate to jaundice, very classical of leptospirosis. Renal dysfunction, if there is renal dysfunction, you can have an elevated plasma creatinine. Apart from that, proteinuria is one other finding. Because there is tubular dysfunction, you can have proteinuria, pyuria, hematuria. And lumbar puncture in case of meningismus, you can demonstrate lymphocytic predominance. Okay. Peripheral smear, as already discussed, you can have leukocytosis which shift to the left, neutrophilia and thrombocytopenia can also be present. So this is the overall chart to show the definitive diagnosis of leptospira. Okay, how do I demonstrate or how do I confirm the diagnosis? You can either do a direct evidence where there is demonstration of the organism per se or isolation of the DNA. That is direct evidence. Indirect evidence is the various antibody tests that we do. That is demonstration of antibody to the leptospira. Okay. But then direct evidence test, what are the tests that are included under this? You have microscopy, dark field microscopy or phase contrast microscopy with silver staining or immunofluorescence staining, you can demonstrate the organism, or animal inoculation or PCR. But most of these tests of more of research value only. The practically applicable tests include the indirect evidence test where we demonstrate the antibody to the leptospira. Okay, so in this again you have genus specific test and serovar specific test. Serovar specific test include your MAT, microscopic agglutination test, and genus specific test include your MSAT, that is macroscopic slide agglutination test, ELISA, dipstick, lepto dry dot, immunoelectrophoresis and indirect heme agglutination test. So these are the other serological tests that are available for diagnosis. Okay, now this is the overall view of the various tests that we discussed. Now coming to the culture, isolation of leptospira by culture, the samples that you can collect is blood, CSF or urine. Okay, that is the most definitive way, but then there is a lot of time, that is it takes a long time for the culture reports to come. So it may take even months for the culture reports to come. So practically it is not a possible test for diagnosis of leptospira. Now what about this identification of the leptospira DNA by this polymerase chain reaction or the PCR test? So this PCR is only test which is available or which can be done in the first week of leptospirosis where there is leptospiremia. But then this is again a complicated expensive test and it's only of research value. Coming to MAT. Okay, what is this? Microscopic agglutination test. So this is the gold standard test. But again you have to demonstrate a rising titer like any other serological test. Okay, a rising titer has to be demonstrated from acute and convalescent sample and repeat samples are required. Again it is complicated test, it is more of epidemiological studies, it is used in only research and epidemiological studies. Now we are left with the serological test which includes MSAT, IgM ELISA and other rapid diagnostic test. Okay, so these are the tests which are practically used in diagnosis of leptospirosis. Like any other serological test, these tests have to be done after 5 to 7 days of the fever. Okay, only in the second week, remember, the antibody test becomes positive. Okay, so the advantage of these tests include it's more economical, simple, sensitive and specific test. Single positive sample is adequate for diagnosis, though it needs confirmation with a MAT.